after the treatment, there is a progressive isometric strengthening program that we go through to strengthen the tendons that have now been healed so that there's a less likelihood of recurrence in the future of this condition. Also providing some ergonomic suggestions or technique modifications to help minimize the stress and overuse in that area. And then we do some return to activity planning. So figuring out what a realistic timeline for you to go back to your pre-injury levels of activity are, and figuring out what the best approach for you to do that is going to be. So this isn't really going to mean much to you, but I think it's just important to know that the research shows very specific parameters for healing of tennis elbow. And so we follow the research-based guidelines in terms of the frequency, the number of hertz that we're using, the pressure, the number of bar that we're using. Of course, we have to modify this for tissue tolerance and work up to these specific parameters. But this is really what we're shooting for, because we found that this many pulses at these parameters provides the largest dose of a healing response. And so we want to continuously move towards that whenever possible.